So welcome to another episode from The Grapevine. We missed you. I'm Tina.
I'm Susie.
I'm Susan.
I'm Nader.
Okay, and we have a special guest with us today, Dr. Nader Wahba. He's a physical therapist, and he will be talking and let us know about what's physical therapist. Hi, doctor. How are you?
Hi, how are you doing?
Good. Thank you for coming.
Thank you for accepting me.
Can you tell us a little bit about your background, about Dr. Nader?
Okay, I'm an old man, 62-year-old,
You don't look your age.
practicing as a physical therapist, 38 years,
Nice.
23 years here in America. Graduate from Cairo University, Faculty of Medicine, High Institute of Physical Therapy. This is like 1980. And since I'm here in the United States, practicing most of the time as my own practice. So
Nice.
There.
self-employed.
Yeah, right? So when you
The American dream.
Yeah, that's right.
So when you came here, did you do some evaluation? You went back to school? What did you do to become
Yeah.
a physical therapist? I know there is some changes.
In my time, 1994, and from probably 1987 until 1999, we was be able to come from Egypt or from Israel, from Holland, because it was a big need here in America for a physical therapist. It was a big need because the health organization here in the United States depend in big part of it for rehab. So they was recruiting us from all these countries, from South Africa too, to come here work with a temporary license. So from day one, which was 4/4/1994, 4 o'clock.
Wow.
Yeah, this is the time I came to Egypt. Second day exactly, I was in hospital working.
Wow.
Yeah, you can imagine, no language, no background, no anything about American health, but we make it.
Nice.
At this time, it was they was accepting us as a physical therapist practicing in the United States with a temporary license until we finish our board exam. I was lucky; I finished the board exam quick. Yeah, and since then I'm practicing, so I never stop.
Nice.
Yeah.
So can you tell us what's physical therapy?
Physical therapy is treating patient without medications. Yeah. Any physical means or any physical methods is meaning physical therapy. So you can treat the patient for pain management, for subacute, like after surgeries, a geriatric patient, pediatric patients, any kind of personal injuries like motor vehicle, like worker compensation. All this, you have to treat it with physical therapy, even with consultation with surgeon, with specialists like orthopedic surgeon, like regular MDs. So, and then it will be time for rehab. After surgeries, it's very important. After stroke or after big illness, it's very important. It's after even newborn kids with any problems, it's also physical therapy. After labor, for ladies, to improve their health condition. And anything making the patient in a better condition, it's considered part of the physical therapy.
So is it similar to like chiropractic or?
It's a little bit different because chiropractor is more specified only for the spine, like for the neck and back, the vertebral column, the spine itself. They do the adjustment, they do the correction for like scoliosis and things like that. But for physical therapy, it's completely different. It's we treating the patient with many things. One of them is the modalities, like using ultrasound, electrical stimulation, shortwave, microwave, infrared, and then manual therapy like massage or myofascial release or soft tissue mobilization, or exercises like exercises for maintenance or for strengthening or for range of motion or for, other things like gait training, like balance. All these we treated in a physical therapy. We also have a big part of the treatment for pain management, for vestibular rehab, like people with losing balance or they have a lot of risk for falls. All these, it's under the physical therapy treatment.
So I know you said this, you were talking about a little bit earlier, Tina had asked, and I know when you came, it was like there was a huge need, so it was probably a special situation, but how is it now? So if somebody was licensed, not in the United States, what would it look like for them to come here and have to, how they can practice?
They still accept them. They have to take the board exam.
Okay.
They didn't have to do any...
Additional hours?
No. Sometimes they ask, some states, they ask for psychology because they didn't take this much in Egypt. But I think they still doing just the board exam. If they pass the board exam, they will be the same like any graduate here. The only problem now is like all the other, it's the TOEFL or all the language barrier. So this is the only problem, I think, now with any new graduate. But they still comes. Matter of fact, somebody just came like a couple of weeks ago.
So how do you like the field? Would you advise any high school student to go through physical therapy school?
Yes, I'm really advising anybody to do it. Money-wise is good. I mean, it's really still high, one of the highest salary, even if you work in government area or in hospitals, it's still good. I mean, it's really much better than a lot of other fields. Plus, it's no liability. Surgeon, it's a lot of liability.
Yeah.
Doctors, it's a lot of liability.
So your insurance costs.
Yeah, pharmacist even, it's a lot of liability. Easy work.
Easy work?
It is easy
I
work.
don't think it's...
No, it is easy.
Just love it. Have to be strong.
No, it's not. It's not at all.
So you're saying it's an easy job, but don't you need a lot of strength? I mean, you have to be really strong to carry someone who might be like heavy or
No.
just immobile. No? I mean, what do you do with someone who's...
Workout.
You have to
You
carry
can use the biomechanic. How to transfer heavy people from bed to chair,
What's
from
the
chair.
biomechanic?
To be able to use your posture, your arms, abilities of the patient. You need to teach the patient how to do this, kind of heavy stuff. I didn't have this much experience in it because all the time I was working with, normal ages, and it's mostly OT, occupational therapist, work with positioning, with wheelchair things, with activities of daily living. So it's usually we have in the team occupational therapist who's doing these things.
So can you tell me about that? I know we talked about chiropractic, but what is the difference between physical therapy and occupational therapy?
Occupational therapy, like I say, they mainly working for the patient's activities of daily living. How to teach the patient to take a shower by themselves, to put makeup, to clean themselves, to comb hairs, to activities of all the fine movement of the hand. So mostly they work with hand more than anything else. Chiropractor workers with spine, OT or occupational therapist working with mostly hands and upper hand and upper arms, and the physical therapy working for most of the patient, muscles and joints, ligaments, tendons.
Okay, what's the difference between physical therapy and chiropractor as a degree-wise?
Degree-wise, this is a school and this is a different school.
Yeah, what's the differences? Like, what does physical therapy do and what does the chiropractor do?
Even like years in school.
Yeah,
I'm not
I
familiar
know.
with that
And
either.
is anyone allowed to have their own clinic?
Both of them have to allowed to have a
They are.
clinic, yeah. But chiropractor, like I say, they mainly working for spine. So they graduate as a doctor of chiropractor, and they do most of the work for the neck and back. Physical therapists, they do everything conflict with any muscles, ligaments, tendons, bones, joints problems. like any kind of pain, any kind of disability, any kind of injuries, subacute patient, like I say, geriatric or kids or everything is with a muscle dysfunction or ligament problems or joint problems or gait problems or balance problems. This all be the field of physical therapy.
I see a lot of kids wearing helmets.
Oh yeah.
I don't know, do you treat those kind of kids or this is something else?
This is mainly if they have what they call it.
A flathead?
Yeah, like
Little caps?
yes.
So that has nothing to do with physical therapy then?
We sometimes help them to control head control, which is when you have this helmet, and usually the skull is bigger than usual, and this is why they put this helmet to get the joints in the skull to be back to normal or to heal. And then the patients usually have a problem with all the neck control, the shoulders muscles. If you don't work with them, they end with a lot of loss in their muscle strength. Anything to support the patient is good and bad. Good to support and bad because you're losing the strength of the muscles and the ligaments and the tendons. So you need to rehabilitate the patient for these things.
So the patients that you see, are you seeing them like weekly or multiple times a week? Or
it's
are you
usually
assigning homework of what they should be doing at home while they're not with you?
Yeah, it's one of the things we put with the evaluation is to teach them what they have to do at home. And most of the time, it's at least 2 or 3 times a week treatment because this is ongoing treatment.
Right.
And usually, like patients after surgeries, if it's subacute, they see them like 7 days a week. And this is in subacute units, like nursing homes or in hospitals. They see them even BID, morning and afternoon, for physical therapy. But this is a very limited time, mostly 1 week, 2 weeks. All the patients after bypass surgery, after cardio problems, they have to have a physical therapy.
So question, does insurance, do you see that insurance covers physical therapy?
Yeah.
It does?
Everything.
Oh, that's great. I
Yeah.
didn't know
And
that.
they cover all the CPT code we use. CPT code meaning if you do ultrasound, it's have a code, electrical stimulation have a code, therapeutic exercise have a code. And sometimes they limited it in codes, but they still pay for everything.
Wow, that's great.
You were telling me earlier, any people that need to lose weight, they can go to a physical therapist.
Of
How?
course.
How?
Yeah,
Tell
we'd
me
like to
how.
know.
I would like to know.
Everybody
Especially if
wants
it's going to be covered by insurance. I don't know if this will be covered or not. But
It will be covered if it's a medical necessity.
okay.
If it's really too
Pleasure,
much,
you guys.
not for you guys.
Well, that's good.
Maybe for us, you never know.
Yeah, but yes, you need to tighten the muscles after you do any procedure for losing weight. Like if you're doing any liposuction, if you're doing any mesotherapy, if you're doing any, you need to tighten the muscles after this, or it will be back again. It's the muscles, is elasticity, and the muscles have to be controlled.
So usually
So-
post-surgery.
Yes, and we do this with all kind of surgeries, like after labor, if you do any sections, or you can do therapy for this. Like teach them how to do all the exercises they needed for build the abdominal muscles, the back muscles, the shoulders, and also we have a big modality which is it's common recently, which is acupuncture or the treatment with to use the acupuncture points. We have a new modality now, they call it MPS or ETPS, electrotherapy point stimulation. This is very good for treating, like obesity, for even stop smoking, for sterility, for,
And does it really work?
And it is working and it is FDA approval, so it's supposedly,
That would be
They
awesome.
try,
Better than
yeah.
vape.
yeah.
What about migraines? Can you do?
Migraines, if it's coming from the cervical spine, it get a lot of good response from physical therapy with modalities like the heat, the stimulations, ultrasound, the massage, all this helping to decrease the pressure from the migraines or from the headaches. So we treat in headaches, dizziness, balance problems, all this if it comes from the neck. If it comes from the inner ear, it's completely different thing. If it comes from the eyes, it's a different situation.
So are you finding that most of your patients will do the assignments or homework that they're supposed to do at home to make them better, or do you find that they're lazy because it's coming?
I don't know if they lie to me or not, but all of them, they say they do it. So usually we have to deal with the patient mentality.
Right.
Like this patient is really will do any of these or not. What's the capability of the patient? Gives them 2 and 3 first and then increase little by little, or just gives them one time, It depends on patients.
If they're a good student.
Depends on even the situation of the patient. If patients have many kids or she's very busy at work, but also it's very good to do maintenance program for the patients. Like all the patients who's in desk all the time, desk work, or drivers who drive all the day. They need a special training for how they handle these situations. It's very important for posture. We have a postural training, which is
Terrible.
I need that.
yeah, we're dealing a lot with scoliosis for young girls when they start to grow up. And they usually hide their, chest. And then they end with a lot of problems like scoliosis. We need to teach the family, as, this is a time for them to show their posture, to sit in, alignment, and it's very important.
How about for the girls that didn't get into puberty, like late in puberty, like didn't get their cycle and...
This is also depends on. We also, like I mentioned before, we treating ladies with like tube problems, like adhesion and tubes or cysts, or which is not allows them to get babies. We do this. We do this with the ultrasound, with the short waves, and with with pelvic floor exercises, pelvic rocking exercises, and you don't believe it. It's getting a lot of good results.
That's amazing. I never heard of that.
It is. It is part of the big part of physical therapy. In each gynecology and obstetric department here in any facility or any hospital, they have a physical therapist working there for this. It's very important, even pre and post delivery or post sections, or they do a lot of things which allows them to not have any problems.
That's really amazing. I wish the fields they communicated more, because pharmacists, I don't think all we know is the medicine side of it and what they can take for it, right? But we don't know that you can, there's those other options to help with that.
It's
and
all
that's really
the time
big.
another option. Yeah.
You mentioned earlier that you can treat pain management. So again, only familiar with the medications for that.
Yeah.
How do you treat that from the physical therapy side?
Yeah, now it's pain management in America, or especially in Florida, especially in South Florida. It's a red flag because of the abuse of the medications.
Right.
You can't believe how many people die in Florida from using the kind of drugs like OxyContin and all that.
For pharmacists now, we have to take a continuing education every year just on controlled substance dispensing to renew our license. And it's the leading cause of death right now is opioid overdosage,
Yes.
So.
And this meaning young people.
Yeah.
It's not meaning old people. So pain management in physical therapy, it's very important. So we have, usually doctors now send patients just to decrease their dosage from this, drugs, by using different things like physical therapy, which includes the modalities, like I say, to decrease the pain. In fact, it's making the pain drops a lot.
So you could do
especially back pain.
acupuncture for that
The
too?
acupuncture or the heat, the simulations, ultrasounds, the massage is very good for this. Myofascial release is very good. Biofeedback, like to teach the patient how to control their pains, their headaches, their migraines, by teach them how to deal with the pain, which is very
This
important.
is
too.
wonderful. It's so different from how it was when we were younger. When we were younger, it's like, let's give you medicine. Let's give you medicine.
Advil,
Now
Tylenol.
let's try something different. Which
Yeah.
I know the Chinese medicine or the acupuncture has been like this for thousands of
Yeah.
years. So the fact that our culture or the American culture now is, let's go towards that. Let's try something different than medicine is great news.
Yeah.
It's wonderful.
It's great news, but they need to do it more, I'll tell you.
Yeah.
Because from the pharmacy side of it, I mean, these drugs are legal that doctors
Yes.
prescribe, but they are physically and mentally dependent.
Right.
Or you'll become dependent on it. And so, like, innocent people who have a fall or an accident or whatever, they might get like a 10-day supply
Yes,
or something like
that's
that. They said after 7 days, you can become addicted. You
Yes.
can. It's not like you
It
will.
depends on. Yeah.
But that was like the statistic, is you can become dependent on it after 7 days. So it's like that is such a better alternate route.
It is
than-
alternate
Yeah, it's
therapy.
better.
Also, aquatic therapy, we didn't talk about it, but it's very good too. It's how to treat patients with using pool therapy, which is how to do the exercises in the pool, how to do relaxation in the pool, how to do feedback in the pool. And this is big thing now in America. I don't have it in my office, but a lot of people have it. Yeah.
So how do you treat someone who has rheumatoid arthritis where they're always in pain and they have to take certain drugs to be able
Yeah.
to remove their fingers or anything? Do you treat people with rheumatoid arthritis?
Oh yeah, of course. Mostly the problem with the rheumatoid arthritis is in the joint. It's in the joint itself. But what about the around the joint, like the ligaments, the tendons, the muscles, the bones? If you can put some of this load away from the joint to the muscles, to the ligaments, to the tendons, this will decrease the pain for the rheumatoid arthritis. So also a lot of patients, becomes much better with using heat therapy, infrared, laser, all these helping a lot. We will not build the joint, but at least, yes, we can control what's around the joint. The same like the back pain. The pain is coming from the vertebrae, but you have around the vertebrae many layers. You start with the skin, the fascia, the muscles, the ligaments, the tendon, and then, you see the bones. If you able to do all these things in a very good condition, of course it will control the bones.
Relieve some of that pain. Wow, this is really that's just
Yeah.
amazing.
Yeah.
Especially because people with rheumatoid arthritis, they die basically paralyzed or they die from pneumonia because.
In fact, physical therapy with researches, it's a lot of things now. Like they treat wound care now. All the big wounds,
Yeah.
you cannot control it with medication. It's treated by physical therapy now. So we have a very big section in the hospital for wound care. It's also managed and treated by physical therapists.
Wow.
Well, I can see why the pay is so good then.
Yeah.
I
Yeah.
wouldn't want that.
Yeah, it's
Great.
good chance for young graduates who want to be a physical therapist. I'm encouraging them to do that because it's, like I say, it's make life better. This is what physical therapy means. And it's our Lego for the APTA or the American Physical Therapy Association.
Make life better.
I like the kid slogan.
Thank you, doctor. Thank you for
welcome.
joining us. We enjoyed you.
It was nice to
Yes,
have you
thank
guys.
you.
Learned a
Thanks.
lot.
very much.
Definitely.
Okay.
Thank you, everybody, and have a great night, and see you next time. Bye.
Bye.